Blacktown and call the member for Greenway.
Thank you, Mr Deputy Speaker. I rise to raise the issue of the recent action by the Minister for Human Services and the self-appointed Liberal duty Senator for Greenway, Senator Payne, to close Blacktown's Medicare office on Saturdays. Now, this is a callous decision. It's going to have an extremely detrimental impact on my constituents, and it reflects a government that's completely out of touch with the community. They're more concerned with introducing an archaic honours system than improving services in Blacktown and Western Sydney in general. I'm quite outraged about this, Mr Deputy Speaker, not only because of the substance of this action, but the way it was gone about. So the minister's cut this service to my constituents, another broken promise from this government that promised not to cut health services. But the minister and her office didn't even have the courtesy to inform me as the local member. And it's not like she's any stranger to Blacktown. I've got before me, I'm very happy to table it if someone wants me to, picture of Minister Payne, who at the time was also the self-appointed duty senator, out doing the campaign launch for Jamie Diaz in Greenway. So it's not like she doesn't know where we are. So she's very happy to go and hang out with Jamie Diaz, but she can't go and do the right thing, do the courteous thing, and let the local member know about this. And it stands in stark contrast to when Labor was in government. We recognised in particular that working families needed accessibility, working families needed to have opportunities where they could access these services, and that's why, thanks to a community campaign from residents in the north of my electorate around Stanhope Gardens, the Ponds and Kellyville Ridge, where they found their nearest Medicare offices were actually quite a fair distance away, either in Castle Hill or in Blacktown, we actually opened a new Medicare kiosk in Rouse Hill to make it accessible for them. Minister Kim Carr came out, and within, I think, a week, he was able to tell me that it had far exceeded the expectations that they had anticipated. What kind of a minister, what kind of a government operates like this? It's a sneaky, mean move by a government with very twisted priorities. My constituents who work Monday to Friday and can't get to their Medicare office during the week rely on it to be open on Saturdays. So this government's decided, not only without prior consultation with the community, not only without any consultation with how it might affect them, not even inform the local member, not even let the public know about it. And if the minister or anyone thinks that all these services can be delivered online, that's plain wrong. Because as has been pointed out by some of my colleagues, when you need to perform certain functions, you need to go in person. This is an outrageous decision by a government with very twisted priorities.
I thank the member for Greenway.